Who has a child or who knows someone with a peanut allergy? Okay, that's pervasive in the West now. What is happening now with children with peanut allergies is they're building resistance up. Right? They're giving them tiny amounts of peanut until their bodies are able to fight it, because it just doesn't make sense. With autistic children, if you use a Now robot, what are you doing? You're taking the gigabit interface away and you're ceding that land. You're giving up. You're not even going to try. You are lowering the bandwidth of communications to talking, kilobits and megabits. So the autistic child, of course, is super comfortable now. But the autistic child will start forming emotional relationships with Thomas the Tank Engine and the Now robot at the expense of you. Because now he's super comfortable and he's developing a relationship in his personality, his social IQ, at a much reduced level, at the kilobit megabit level. The University of Pisa, they use our robots to do exclusively autism research, and very much like this peanut thing. Their studies conclude pretty clearly, autistic children can't deal with you face to face. They completely locked onto our robots, but they are a little uncomfortable. It's that little bit of peanut. They understand that when we're doing social training, social therapy with our robots, that when the robot's smiling, it's a smile. And it's much easier to take that smile after hundreds of hours of training and to be able to, okay, it's close enough, I get it. Right? There is, and the crazy thing is that now robots, they used to be $25,000. Right?
It's 16,000 and then 8,000 for research purposes.
That's right. So you know, this little low bandwidth crutch that doesn't do a whole lot, right? Who's got $16,000 to throw around? I wish I did. Right? Imagine a full-size human expressive robot that is 95% automated. Maybe someone, again, from Manila is operating 10 of them or whatever. For $500 a month, you can do 40 hours of human social therapy. I cannot tell you how, my wife's on the board of the Child Development Center in Hong Kong. My son was born 4 months early, 600 grams. And thank God he's doing, relative to all things considered, doing great, but you know, the CDC in Hong Kong was just wonderful for him. But most of the kids at CDC have some sort of spectrum issue, right? The cost for caring for these children, massive. But the consequences of not doing the 40 hours a week, if the child does not get 40 hours a week for 2 years, the likelihood of just a moderately spectrum child of being permanently dependent on you or the state for the rest of her life is 88%.
Wow.
I mean, massive costs to us as caregivers and as family members, but in terms of, you know, the cost to society, right? And both in terms of productivity and healthcare costs, it's pretty massive. Does anybody have any questions while I calibrate this guy?
I'd like to make a statement.
Sure.
In the last 2 years, some very, very important papers have been released on autism and robotics, but as a community, we're still working in high isolation. Meaning your company's doing your thing, our guys over with the Now robot are doing our thing,
sure.
But it's going to take our papers to come together to make the impact that we need, because some new breakthroughs have come through this year with color coding and the visual tracking systems of our robots.
Okay. Are you actually a researcher with using Now?
I have a master's in special ed, and then I was cross-trained in robotics as
Yay.
I joined this organization.
Okay, fantastic. Yeah, so we're closing the Plano, Texas office to establish an office in Los Angeles.
Yeah.
So, you know, that's one of the reasons I wanted to come introduce ourselves and say hi.
Yay.
And, you know, we, because of the entertainment impact and service impact in Los Angeles, we recently hired a veteran from Pixar to create backstory and personality. He actually just moved to Los Angeles from the Bay Area. Our head of sales just happens to be based in LA. I grew up in LA. I grew up all over the place. We live up, who knows where Pyramid Lake is? Yeah, we have a 180-acre piece of dirt way up there.
Wow.
So my folks are semi-retired. It's my brother Joe. He's up there. He's taking care of the property. But you know, I've lived all over, as far south as Torrance, and we're not that far from Torrance, right?
Yeah, no.
Calabasas, all over. But I miss home, and we want to do a lot of this stuff here in Southern California.
Good for
and so
you.
we were just with the Interactive Human Robotics Group at USC yesterday, you know, we totally get it. Ironically or unfortunately, a lot of the research for these sorts of things is progressing much faster in Europe and in Asia. In Europe, because it's just socialized medicine, and their costs are growing up even faster than the United States to the healthcare costs, right? And because it's socialized, they've already agreed to pay for everything, right? So University of Geneva, to live in Geneva costs 5 times more than here. You can imagine the healthcare costs because nobody's having kids in Switzerland, right? And there's no immigration allowed. It's impossible for you to become a citizen in Switzerland. Okay, so they're incentivized to find ways to make this work. They know painfully how inefficient it is to throw bodies at it, right? And how expensive that's becoming. We know, you know, as Americans over the past 20 years, the cost of healthcare and education in terms of inflation number, 3 times higher than everything else, right? And there's no sign of it abating. So it's moving fast there. In Asia, the dynamic is different. They've not been used to getting anything, right? This is, you know, so many of the first generation middle class really, you know, in the world are really coming into the market in Asia, but they see the quality of services that, you know, the West gets, you know, and guys in China and India are innovating to deliver that at 80% quality for 20% of the price or 10% of the price. So those are the vectors driving it. But we are very excited about the U.S. market because this is much more of a free enterprise, individual and family-driven market. We're not, because of how quickly spectrum children grow out of their zone when they can benefit the most from social therapy, right? We don't necessarily want to wait for 5 years of clinical research. We don't want to wait for insurance companies to see how valuable this is and agree to pay for this sort of service 3 years from now, right? We have enough research and we have software from a lot of our research institutes from around the world to start private sector trials here. If families, for example, have autism, you know, just like homeschooling, right? It's pervasive in California, right? Parents of autistic children get together, they have communities. And to be able to see very, very quickly, as you said, in a matter of hours, all of a sudden, right, you see vast improvement.
It took us 10 weeks, but it was good.
Yeah, that's great.
We had progress.
So, you know, we're really excited because in the U.S., you know, individual players can make decisions for themselves, right? One of the things we want to do, I don't know if you realize, but robots are already being used as patient simulations, right, for doctor, nurse, and medic training. It's already a $1.5 billion business. And so the U.S. Army has asked us to produce an expressive human robot that can operate by itself, or, again, think of avatar mode. You can now move in time and space and still have a physical expressive presence, right? So let's say you have that registered nurse in Manila who can actually pretend to be that traumatized patient in the field, screaming, yelling, playing whatever script you want her to play, right? In the field where that robot's wiggling and screaming and pumping out blood on the field. In terms of getting, you know, real, as close to real training for that medic when she has to do that, when it matters for real in the field, it doesn't get any better. If you look on the web and see what human patient simulation robots look like now, they're terrible. And they're really expensive because it's an oligarchy. There's 2 companies that do most of that, right? And that's your dollars. Those are my dollars going there to pay for that. More questions, please.